Welcome to Science, Health and Healing, Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Metabolic Syndrome and Insulin Toxicity. I have suggested in my past writing that the term, the metabolic syndrome, should be discarded. It should be replaced with insulin toxicity. If you consider insulin toxicity, this is a term that I introduced some time ago. You will notice that all the clinical aspects of the metabolic syndrome, the clinical features, the clinical signs, the complications, the delayed consequences of insulin toxicity are the same as they have been put in the literature for the metabolic syndrome. It's the same thing. So then why should we discontinue the older term, the metabolic syndrome, which is known to everyone, and replace it with insulin toxicity for a very strong reason? The metabolic syndrome creates a dark box of mystery. The patients really do not know what it is. Oh yes, they're told that you have lipid abnormality, fat abnormality, you gain weight, you have increased risk of heart disease, stroke, kidney failure, inflammatory disorders. But it really doesn't define for you. On the other hand, insulin toxicity is very straightforward. It just tells you that there is a toxicity problem of excess insulin. And you can easily have it detected, clearly diagnosed in an objective, quantitative, numerical way. Just have a 3-hour insulin test done. The glucose comes along with it, but that to me is not important. And if you don't want to do all the way for 3 hours, especially for children and adolescents, you might do it just for 2 hours. Now it will clearly define what the problem is. Ideally, fasting insulin level should be less than 2, and the peak insulin level should be less than 25 units. Now don't be surprised if your peak insulin of your child, your toddler, your adolescent or adult is 3, 4 or 10 times as much. Now it also gives you a clear direction. You define the problem, now you can also define the solution. Please watch the companion segment, Dr. Ali's diet plan for insulin reduction. And I hope that this short segment has stimulated your interest, and you look at several other video articles included in this playlist channel, this channel devoted to the problems of insulin toxicity. So it will deepen your understanding of the problem. And of course, I give you a lot of specific examples, what foods increase the rate of insulin release, and that also means quantitatively more insulin. What foods reduce the rate of insulin? I'm trying to underscore the importance of the rate of release of insulin, because in other articles I explained to you how a sharp surges in insulin level sharply drop the blood sugar, you feel the effects of hypoglycemia, and you go to eat something, and usually that's the wrong thing to eat. So again, the short message of this program is we should discard the term the metabolic syndrome. We should replace with insulin toxicity for the reasons that I've given you. Our vision at this encyclopedia is to provide authentic information untainted by corporate deceptions. Children's Health Core is a nonprofit foundation my wife and I funded some years ago with a mission and a vision of providing information to children, adolescents, their parents, their teachers, their grandparents, focusing on issues of nutrition, environments, and thoughts. Please visit our website. That's www.kids123.org. There is so much information that we have posted on that website. Thank you. Thank you so much.